Every October, we see pink everywhere, ribbons on shirts, posts on social media, and campaigns that remind us to care, to check, and to remember. But breast cancer isn't just a month of color, it's a movement. It's a call to action that reminds us that early diagnosis can save lives, support can make our journey lighter, and that hope can bloom even in the darkest moments. In India, breast cancer accounts for nearly 30% of all cancers in women, and experts warn that by 2030, the cases might rise up to 2 lakh per year. Lifestyle factors such as lack of exercise and consumption of processed foods is contributing to the alarming increase. About 10% cancers are genetic. That means they are inherited within families. But beyond the numbers and slogans, this is about the people, the mothers, the daughters, the sisters, friends, and yes, even men who deal with the diagnosis with exceptional courage and strength. Awareness begins with knowledge, with asking questions, and breaking the silence that keeps many away from getting the test done. And today, we are here to do exactly that, to ask, to learn, and to understand. Joining us is Dr. Ashma Gulia, who will be answering some simple but vital questions.
Breast cancer, if found early, is highly treatable, and most women and men who have been diagnosed early and treated early go on to live long and healthy lives. So, if you've been meaning to book that screening checkup or book that screening test and have been putting it off, please do it. 15 minutes of your consultation or your screening could give you years of peace of mind and can help you live happily without fear. You have to examine your breast preferably once every month after you're done with your periods, that is 7 to 10 days after your periods. You have to do a self breast examination. But if you're not menstruating, or if you have attained your menopause, then fix a date for every month, say first of every month. Now moving to how to do the breast self examination. Stand in front of the mirror, undress yourself from the waist up. Keep your hands relaxed by your side, and visual examination. Look for the size and shape of your breast. Notice if there is any abnormal change in the size or appearance of your breast. Notice if there is any redness, skin puckering, skin changes, dimpling of your skin, any rashes or scaling around your nipples. See if there is any nipple discharge, if there is any visible lump. All these things you have to notice. So it's very natural to be nervous and scared before going for any test, let alone the mammography test. But we should understand that certain tests are important, and mammography can pick up early signs of cancer so that we can treat you better and you can be cured of. Also, think of preventive health checks as car servicing. Your car is not having any problem, but you do regular servicing and regular checks so that your car has a smooth and a long life. Similarly, preventive health checkups are very important to ensure a long and a healthy life. So there are a few guidelines recommended for screening of breast cancer, which is between the ages of 20 to 30. Be breast aware and get your clinical breast examination done if you notice something abnormal once in every 1 to 3 years. After the age of 40, between 40 to 50 years of age, you have to get a yearly clinical examination and mammogram done. Between the ages of 50 to 74, once in 2 years, and after 75 if you're still healthy, be breast aware and do the screening uh, whenever you notice anything abnormal. So yes, many women in rural India do not have access to mammograms or specialist consultant visits. But that doesn't mean they cannot take strong practical steps to prevent the breast cancer, even without any investigations or doctors nearby. You are your own first line of defense against diseases. So awareness is very important. Awareness about your own normal tissue and awareness about how an abnormal tissue would feel is very important. So the local primary healthcare centers, the doctors over there, or the Asha or Anganwadi Didis, they are well versed or they are trained in breast examinations. They can teach self breast examination to these women and make them get into a habit of routinely examining their breasts after every period. Picking up signs early, reporting them early can go a long way in preventing breast cancers, and also maintaining a healthy lifestyle, eating locally produced fruits, vegetables, whole grains, and avoiding processed foods, alcohol, smoking. All these things will go a long way in preventing breast cancer. So, being aware, regular screening, regular self examination and screening, and reporting early can prevent breast cancers even in rural women. Only 5 to 10% of breast cancers are due to inheritance of faulty genes or defective genes, that is due to mutation in the BRCA1 and BRCA2 genes. Otherwise, most of the breast cancers, that is 90 to 95%, are sporadic and because of lifestyle and environmental factors, and also due to accumulation of genetic damage over a period of time. So if there is a family with a history of ovarian and breast cancer in the mother, in the sister, in the grandmother, these can hint towards a genetic inheritance or a genetic pattern to the breast cancer. But otherwise, most of them are due to lifestyle related, which include obesity, alcohol and smoking, poor food habits, stress, lack of sleep, uh, excessive estrogen in the body, lack of breastfeeding. All these things can contribute to breast cancers. So remember, genetics can only load the gun. It's your lifestyle that will pull the trigger. That's a very insightful and a very important question, because even though breast cancer is often thought of as a woman's issue, it can happen in men too. And out of one out of every 100 breast cancer cases happens in men. Therefore, creating awareness amongst men is very important so that they can take care of their own health and also be advocate of the health of the women in their lives. So, what should men look for? So men have a small amount of breast tissue behind their nipple, and this is where cancer can develop, especially if they have a family history or genetic mutation in the BRCA1 and BRCA2 genes. So if they have to look for any abnormal swelling behind the nipple area, any changes in their nipple, that is nipples turning inward, which we call as inverted nipple, any nipple discharge, any swelling in their armpit, if they notice any of these changes, they should report to the doctor and get examined. Always remember, early detection saves lives. And also, men should get educated themselves about breast cancers and then can spread awareness in their home, encourage the women in their lives to do monthly self breast examination, and seek appropriate care whenever there is any abnormal changes that they notice.
As we wrap up, I want to remind everyone who's listening that knowledge isn't just about knowing the facts, it's also about taking the action. It's booking that appointment, it's encouraging a loved one to get screened, it's eating well, moving often, and showing up for ourselves and each other. Breast cancer awareness doesn't end when the calendars turn. It lives on in every conversation we have, in every life we protect, and every story that we choose to listen to. Because when we know better, we can do better, and together we can save lives. Thank you.